common is MGD in dry eye? And is it a part of the differential diagnosis of dry eye, or is it really at the core of dry eye?
Well, obviously, it's a ubiquitous problem. I'd say everybody over the age of 40 in my practice has some evidence of meibomian dysfunction, yet a lot of patients aren't symptomatic. And from my perspective, meibomian gland disease is part of that whole functional unit in regulating ocular surface homeostasis. And certainly they play a key role in minimizing evaporation of tears and maybe have anti-inflammatory effects and keep the tears from rolling out onto the lid margin. But most of the patients that present to me that have meibomian gland disease have some tear composition problems, I'm sure. It's a tear dysfunction disorder, and the majority of them have some ocular surface disease, usually corneal, altered corneal permeability, usually on the lower cornea, and a very rapid breakup time. So that's usually what brings them in with a meibomian gland disease. And I can make them, I can actually make them better, almost symptom-free, by treating their ocular surface disease, and their meibomian glands may appear exactly the same as they did before. There's no change, maybe a little less red, but there's no real change. So again, from my perspective, it's more of an ocular surface secondary effect.
Well, I think it's chicken and egg. Generally speaking, it can be secondary. I think that's great insight. Obviously, sometimes it's primary, and you do have meibomian gland disease. You decrease your oil, classically, evaporation, classic story. Surprisingly, though, if you have someone, let's take a natural experiment, ectropion. Okay, your lids are hanging out like this here. Now, it's conceivable, you don't get ectropion in the upper lid, so it's conceivable those 30 glands are still taken over. But when you entirely remove the lower lid meibomian glands, these people, you don't necessarily get dry eye. So how important are the 30 and 30 lower meibomian glands with presumably functioning upper? And don't forget, this normally happens in elderly people. And with age, you start to lose your, by the time you're 70, you've only got like probably half your 50, you're down to 15 or 12 with the glands functioning. And so most people with ectropion seem to be doing pretty well. Now you could say, well, they got a huge pool of tears, and every time they blink, there may be offsetting mechanisms. But it's sort of, there's a tremendous reserve. And it's hard to do a one-on-one relationship to it. I mean, there is minimal Sika syndrome, the condition that occurs in generally young ladies, where they'll get a little bit of a decrease in the tear meniscus, a little meibomian gland disease, so it's mild dry eye and mild meibomian gland disease. And how these two components interact with each other is that once the tear meniscus decreases, you get a little drying out over the orifices, orify, of the meibomian glands, and that affects the texture of the opening, and it causes operculums to occur. Is hard to say. I did notice in your talk that while you were mentioning that from your side, you like to you sense that ought to be separated out.
We've tended to see it appear to act differently, and so to that extent, we think it's probably warrants being in a separate trial. That's correct.